Hello, I'm Prof. Azhar. I'm an orthopedic surgeon in ALTY Orthopaedic Hospital, and I specialize in hip and knee surgery as well as trauma orthopedic fractures. 3D printing is when we get a CT scan of the patient, and then we can get a 3D image of the patient. And then we can either print the bone or we can simulate the surgery. You can 3D print a device to help you to do that surgery more accurately. I started using 3D printing, I think, more or less 20 years ago, maybe 2003. That time I was a hand and micro surgeon, and we were doing reconstruction of the jaw. So here there was tumor of the jaw and we were going to excise it, and so we can use 3D printing to sort of like visualize how to make the jaw out of the fibular bone in the leg. Okay, maybe I can show you some examples to illustrate the philosophy. On the x-ray it doesn't look very obvious what was the problem, because it was more a problem of the top part of the knee. Okay, and so we are able to 3D print the opposite tibia and this tibia, the one which you can't walk on, and then only you can see in comparison what the problem is. There's like a big hole in this area, which you can't see on x-rays very well, because when you take an x-ray like that, or like that, the bones overlap and you can't see it unless you do a 3D CT, and it helps to then 3D print to understand what the problem is. The benefit of using this technology, just now I explained how you would appreciate the problem, but there are two quite important benefits, and I'll give you two examples. One is from fracture surgery and the other one is from realignment surgery. You can see this is a young man, and the knee, if you draw a line from the center of the hip to the center of the ankle, it's not crossing in the middle of the knee. So that means the knee is wearing out on one side because all the weight is going down on one side. So we can correct this by cutting the bone, realigning that knee. Now this surgery you can do, of course, using just x-rays and drawings, but now a much more sophisticated way of doing this is to get that pre-operative CT scan into a three-dimensional image, and then making that cut based on the 3D CT, and then we can 3D print a device which is specific to that patient so that we can do this much more accurately. This is a very common fracture. It's a clavicle fracture, which is your collarbone here, and you can see these are the ribs, and this is the right shoulder with the hand upwards, and this is the collarbone. So one of the things that we can do to really look at this fracture is we can do a three-dimensional CT scan. And you can see here that's what we've done. And not only we can do the three-dimensional CT scan, but in ALTY we can also digitally subtract the other bones, and we can just look at the clavicle. When that's done, you can take this further and you can 3D print the clavicle. We can digitally produce the opposite clavicle and mirror it. So this is what the clavicle should look like, and this is the broken clavicle. We can take a plate and we can contour the plate to this model, so that during the surgery I don't have to open up the fracture site. I can just make two short incisions on either side of the clavicle and slide this pre-contoured plate, because it's been contoured exactly to fit that patient, and then I can use the plate itself to bring the two bones ends together without opening up the fracture site. And there's good advantage in doing that, because one, you don't disturb the biology of the fracture and the fracture should heal faster, and two, with this 3D printing application we can make sure that the plate fits exactly well to the collarbone.